human papillomaviruses are the infection that is the most common cause of sexually transmitted infections in the world. Now, when people think about sexually transmitted infections, they think about syphilis, gonorrhea, chlamydia, HIV, even hepatitis B maybe, but they don't think about HPV as being sexually transmitted, and certainly not as the most common sexually transmitted infection there is. By the time they're 50 years of age, 80% of people would have been infected with at least one HPV type. That is a huge proportion of the population. It's estimated that there are about 80 million Americans that are infected with genital HPVs. So that's the prevalence of disease. And there are about 14 million new infections that occur each year. So that's the incidence of disease in the United States. Now, in terms of disease impact, this is the infection rates. If we look at disease impact, there are about 11,000 or so, 12,000 new cases of cervical cancer that's caused by HPV in the United States. There are another about 11 or 12,000 cases of head and neck cancer that's caused by HPV in the United States. So these infections have a tremendous burden in terms of causing disease that a lot of people, even healthcare providers, don't necessarily know about or understand completely. What people should be worried about is getting these diseases that the vaccines are designed to prevent. And I think that's the message that gets lost sometimes, is what is it that we're really trying to prevent? We're trying to prevent cancer. These are real diseases. And yes, we do have screening programs, but our screening programs are not 100% effective, whereas our vaccine is close to that.